Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today I'm talking to Dr. Sharon Tate about ovarian cancer, what the issues are and what action is needed. Dr. Tate, could you start by introducing yourself?
My name is Dr. Sharon Tate. I am Head of Primary Care Development at the national UK charity Target Ovarian Cancer.
What is the scale of the problem and what do we need to know?
Primarily, we're worried about the over 7,000 women that are diagnosed with this disease every single year in the United Kingdom. Primarily, ovarian cancer is diagnosed in women aged 50 years or over. However, approximately 20% of cases are diagnosed in women under that age, and this is often associated with a family history or a known genetic mutation in one of the BRCA1 or BRCA2 genes. We know that after age, family history is the biggest risk factor associated with ovarian cancer. Unfortunately, at the moment, the majority of women are diagnosed with advanced disease, so disease that is spread outside of the ovary. But what we do know is that when the disease is diagnosed at the earliest stage, 9 in 10 women will survive. But currently 2/3 of women are diagnosed late when the cancer is harder to treat. This has really devastating impact upon the long-term outcomes for women. Every single day in the United Kingdom, 11 women die from ovarian cancer. One of the big challenges we've got at the moment is an absolute awareness crisis in ovarian cancer. We've done some work recently as a charity, and what that clearly showed us is that 4 out of 5 UK women do not know that bloating is a key symptom of ovarian cancer. And we also know the counter side to that. Sadly, GP training is woefully inadequate. Knowing the symptoms is the best weapon that we all have against this disease. There is no screening, so it's up to the individual and their GP.
And now could you tell us, what are the symptoms of ovarian cancer?
The most commonly reported symptoms are persistent bloating, abdominal pain, feeling full or difficulty eating, and needing to wee more urgently or often. Now, to break this down a little bit for the healthcare professionals that might be listening, when we talk about bloating, that's kind of the lay term we use. What we're talking about actually is abdominal distension. So we're thinking about those patients that have an extended abdomen, their tummy size is growing, modifications to diet or exercise and not managing this, and the stomach continues to expand in size, often with the need to buy new clothes to accommodate it. In terms of feeling full or difficulty eating, again, we're thinking about early satiety. So we're thinking about women who maybe sit down to a meal that they would normally be able to eat quite easily. Suddenly they're in a situation where they're taking a couple of mouthfuls, getting through half the meal, and they just physically cannot manage anymore. So we're thinking really about these symptoms in the context of change and not being normal for that person. Other things to consider are things that are quite common to many cancers, which include extreme fatigue and unexplained weight loss. The other that is, again, more specific to ovarian cancer is changes in bowel habit. This could be diarrhea or it could be constipation.
You mentioned late diagnosis. Why is late diagnosis of ovarian cancer common, and what can be done to make it earlier?
Late diagnosis is a really complex problem that we cannot attribute to one single thing. But to put it really simplistically, as I've mentioned already, we have a huge problem with awareness of symptoms among the general public. We also have an issue with awareness amongst GPs and therefore them recognising symptomatic patients when they present. And also the NHS systems are not always in place to support GPs to get that early diagnosis for patients. Target Ovarian Cancer is working across all of these issues. We're currently calling for a dedicated symptoms awareness campaign across the UK so that we can finally make some progress on public awareness. And as an organisation, we offer a comprehensive range of training and education materials for GPs, including e-learning modules with BMJ Learning and RCGP that you can find on our website. And we also have a project that's currently underway that is seeking to overcome some of the delays or to address some of those systematic barriers that may be causing delays in diagnosis.